When I think of universal health care, my mind immediately thinks of Canada and their unique health system. So today I want to discuss with everyone the topic of whether the US should implement universal health care. But first, let me take a step back and explain to you why Canada comes to mind and also the differences as well as the similarities of our health system. The US has ACA, the Affordable Care Act, also known as Obamacare. It is part of the Healthcare Reform Act passed in order to make health insurance accessible to more citizens. It does two things. Firstly, allows states to expand the Medicaid program to cover any adult whose income is 138% below federal poverty level. Not all states have chosen to do this. The ACA has also created tax subsidies, known as premium tax credits. These credits are for people who have household incomes between 100% and 400% above the federal poverty level. This was done in an effort to make healthcare plans more affordable for Americans who couldn't otherwise purchase them. The ACA also set up exchanges where people entitled to tax credits could purchase insurance plans on a yearly basis. Lastly, the ACA affords citizens certain rights such as access to free preventative health care and requires insurance to cover people with pre-existing conditions. Benefits under the ACA must be renewed yearly. The ACA also removes lifetime limits on insurance benefits for healthcare services that are considered essential. It also protects your right to choose your own doctor. Depending on the type of care you have, a payment option can differ greatly. If you have private health insurance, you and your employer pay the premium. If you're self-employed, you pay these premiums on your own. Under the ACA, you might receive tax credits to help pay for your private insurance plan, but some expenses may be out of pocket. Medicare and Medicaid are both publicly funded through tax dollars. However, there are Medicare plans that can be purchased and give additional health coverage. That is the US, and that's how they run their health system. As for Canada, they have 10 provinces and 3 territories finance and run a state-wide health insurance plan. There is no cost sharing for the services guaranteed under federal law. While they guaranteed access to the hospital and physician services, it is up to each province to decide whether to cover supplementary benefits like dental care and drug coverage. About 2/3 of the Canadians take out private supplemental insurance policies to cover those services. In one 2011 study that found that nearly all Canadians spending on dental care came from non-government dollars, 60% covered by employer-sponsored plans and 35% paid out of pocket. Some Canadian legislators have made pushes to increase the scope of Canada's public health plan to cover more services, but have so far proved very unsuccessful. While Canada's healthcare system is publicly financed, many providers are not government employees. Instead, doctors are usually reimbursed by the government at a negotiated fee-for-service rate. The average primary care physician doctor in Canada earns about $125,000. In the US, that number stands at $186,000 annually. I know that Canada states that they give universal care for all. However, in Canada, regular visits to primary care doctors, hospitals, and diagnostic services are covered by a provincial health insurance. However, there is some cost sharing when it comes to other services like ambulances, prescriptions, over-the-counter medications, dental, vision, and long-term care facilities. This does pose a bit of an issue for people who have large out-of-pocket expenses, but the government does provide a tax credit to ease that burden. There are some pros and cons to their system for a single-payer healthcare. The Canadian system doesn't cover everything, and private insurance is often used to supplement coverage. There can also be co-pays for medical necessities, like prescriptions. Then, of course, there are Canadian healthcare wait times, which many Americans would consider very unreasonable. These wait times stem from many things, but currently there's about one primary care physician per 1,000 people. So, the rate of available specialists is similar. Patients are guaranteed reasonable wait times for urgent needs. However, they can expect to wait longer to see a specialist or have an elective procedure done. Generally, all efforts are made to streamline appointments for life-threatening issues, but there can still be some wait time involved. From the time it takes to receive a referral by a GP to receive treatment, Canadians wait an average of 21.2 weeks to receive treatment for a specialist. Now, for MRI procedures, it could take up to 10.8 weeks. Some argue, once again, the wait times are far too long. How are these two separate healthcare systems so similar? If you're looking for a comparison between the US and Canada, you can consider Canada's system to be extremely similar to the US Medicare system. Canadian Universal Care doesn't cover everything. However, through the CHA, it dictates that medically necessary services are covered at no cost. However, there is no distinct definition on what is medically necessary, means specifically leaving each province and territory to decide. So, what is the major economic impact that would affect the U.S. if we implement universal health care? As of now, with the ACA, the impact, it basically, the last problem is the price of care. According to CNBC, the average family spends about $996 for health insurance premiums in 2016, and the average individual paid around $3,852. This doesn't include the deductibles or copays. When the deductible is added to these figures, a family spent a total of about $18,000 in 2016, and an individual spent somewhere around $8,210. That's a huge impact on the US. So now when I think about the Canadians and how they take care and manage their workload, I think of how Canada has obviously lower costs in units. Like, for instance, an MRI in Canada, it costs on an average, it costs about $824. But here in the US, it's about $1,200 per MRI. So when you think about all those things, think about all the administrative costs that it takes to handle all these requests. So I think about how much is it going to cost for the US? How much is it going to cost for Canada? For me, I would imagine that it would be definitely a higher price tag for the US versus Canada because they do have one single payer system. Therefore, the administrative work would be less. But I actually looked into this, and in 2010, the Health Affairs Studies found that doctors in Ontario, a Canadian province, spent $22,205 each year dealing with the single payer agency, compared to the US. American doctors spend dealing with private insurance companies, Medicare and Medicaid, a whopping $82,975. Canadians certainly view their healthcare system as a crucial to national identity. 85% say that eliminating the public plan would result in a fundamental change to the nature of Canada. So when I think of all these benefits, other than the con of the wait time, I feel personally, in my personal opinion, that we are just so close to mirroring that health system that we should just move forward with it. The numbers show that we would actually save a substantial amount on administrative cost. Not to mention, there is a con to that. That means we would not have jobs. And I think about that in the healthcare world that I am in currently. If I didn't work here in the US and I worked in Canada, I probably wouldn't have a job. And it would probably be, the jobs would be so much harder, to come by. So there is some pros, there is some cons for the US. if they choose to implement universal health care. Definitely, it would affect our bottom line in our personal pockets because as of now, we are currently spending, this was back in 2016, a total cost of $18,000. And in Canada, they're not doing that. They're only paying out of pocket for supplemental services. However, once again, the wait time can be a discerning point. But if you're living a healthy life and you are taking care of yourself preventatively, I believe that this is doable for the US. And in my opinion, we should just move forward with implementing that and making sure that everyone is covered. However, we will have a downfall of people having jobs, but I really feel that it would be a great benefit for everyone. So once again, thank you, everyone. My name is Adrienne Lloyden, and I appreciate your time. Have a good day.